So I want to talk about gonorrhea. What is gonorrhea? Gonorrhea is a sexually transmitted disease that can cause infection in the genitals, rectum, and in the throat. It is very common, especially among young people ages between 15 to 24 years. And how can I get gonorrhea? How is gonorrhea spread? You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant person with gonorrhea can give the infection to their baby during childbirth. And how can you or I reduce my risk of getting gonorrhea? The only way to completely avoid this is to not have vaginal, anal, or oral sex. If you are sexually active, the following things can lower your chances of getting gonorrhea. Being in a long-term, mutually monogamous relationship with a partner who has been tested and does not have gonorrhea. And the second way is using condoms in the right way every time you have sex. Am I at risk of getting gonorrhea? Yeah. Sexually active people can get gonorrhea through vaginal, anal, and oral sex without a condom with a partner who has gonorrhea. So, if you are sexually active, have an honest and open talk with your healthcare provider. Ask them if you should get tested for gonorrhea or other STDs. If you are sexually active, a gay or bisexual man, you should get tested for gonorrhea every year. If you are sexually active woman, you should get tested for gonorrhea every year. If you are younger than 25 years and older with risk factors such as a new or multiple sex partners or a sex partner who has sexually transmitted infection. I am pregnant. How does gonorrhea affect my baby? If you are pregnant and you have gonorrhea, you can give the infection to your baby during the delivery. This can cause serious health problems for your baby if you are pregnant. Talk to your healthcare provider about getting the correct examination, testing, and treatment. Treating gonorrhea as soon as possible will make the health problems for your baby less likely. How do I know I have gonorrhea? Gonorrhea often has symptoms, but it can cause serious health problems even without symptoms. Most women, most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Symptoms in women can include painful or burning sensation when peeing, increased vaginal discharge, and vaginal bleeding between the periods. And in men, a burning sensation when peeing, a yellow, white, or green discharge for the penis, and painful or swollen testicles, although this is less common. Rectal infection may either cause the infection or cause symptoms in both men and women that may include discharge, anal itching, sourness, bleeding, and painful bowel movements. So, how will my healthcare provider know if I have gonorrhea? Most of the time, healthcare provider will use a urine sample to diagnose gonorrhea. However, if you have had oral and or anal sex, your healthcare provider may use a swab to collect sample from your throat and or rectum. In some cases, a healthcare provider may also use a swab to collect a sample from a man's urethra, that's the urinary canal, and or a woman's cervix, that's the opening of the womb. Is there a cure for gonorrhea? Yes, the right treatment can cure gonorrhea. It is important that you take all the medicine your healthcare provider gives you to cure your infection. And note this, do not share medicine for gonorrhea with anyone. Although medicine will stop the infection, it will not undo any permanent damage caused by the disease. And when can you have sex, or when can I have sex again after my gonorrhea treatment? Wait for 7 days after finishing all medicines before having sex. You and your sex partner or partners should avoid having sex until you have each completed treatment and your symptoms are gone. This will help to prevent you and your partner from giving or getting gonorrhea again. Sorry. Those with gonorrhea will be tested and should be tested about 3 months after treatment of an initial infection, even if their partners receive successful treatment. What happens if you don't receive treatment? Very important. Untreated gonorrhea can cause serious and permanent healthcare problems. In women, untreated gonorrhea can cause a pelvic inflammatory disease. Some of them are complications of the PID, which are formation of a scar tissue that blocks the fallopian tube. We have an ectopic pregnancy. This is pregnancy that comes outside the womb. And then we have infertility, not being able to get pregnant. And we have a long-term pelvic abdominal pain. So in men, gonorrhea can cause a painful condition in the tubes attached to the testicles, which can in rare cases lead to infertility. Rarely, untreated gonorrhea can also spread to your blood or joints. This condition can be life-threatening. So, untreated gonorrhea may also increase your chances of getting or giving HIV. That's all about that's all about gonorrhea. And comment, give your like, subscribe, and share this information to help our young generation that is growing outside there. Thank you.